This is Chapter 19, Part 9, where we're going to look at homeostatic imbalances in the blood. One thing I forgot to mention on the last video is that when we're looking at people with ABO blood types, so AB, AB, or O blood types, if the red blood cells in their bloodstream don't have the antigens for A or B, say they're O, then they're going to have those antibodies in the plasma, just present in the plasma. So if they don't have A, then they're A antigen on the red blood cells, then they're going to have the anti-A antibody in the plasma, and same with the B antigen. Now the Rh factor is a little bit different, so this is what's denoted by this plus or minus after the letter. So that's going to be the Rh factor. If it's plus, then you have the Rh factor on the red blood cells, and if it's negative, then your red blood cells don't have the Rh factor. Now, you can receive blood from either positive or negative if you have the Rh factor, but if you don't have the Rh factor in your bloodstream, you can only accept from blood that also does not have that Rh factor. So if you don't have the Rh factor on your blood cells and you're transfused with blood that does have the Rh factor, your blood is going to have a negative reaction to that. And your body is going to produce antibodies for that Rh factor. Now, one difference between these two blood types or blood groups is that with the ABO antigens, this is where you will have antibodies floating around in the blood plasma if there aren't antigens on the red blood cells. Whereas the Rh factor, you don't necessarily have those antibodies floating around in the blood plasma if you don't have the Rh factor on the red blood cells. Though, you still have the ability to create Rh or anti-Rh antibodies. So just to be aware that there aren't Rh or anti-Rh antibodies present in the blood at all times. Sickle cell anemia, or sickle cell disease, this is an inherited disorder or genetics, and this is where there aren't enough healthy red blood cells to carry oxygen throughout the body. So because of this, blood's oxygen carrying capacity is really reduced. The red blood cells of a person with sickle cell disease contain HbS, or hemoglobin S. And this is an abnormal kind of hemoglobin. Now, when HbS gives up oxygen to the interstitial fluid, it forms these really long, stiff, rod-like structures that bend the erythrocyte into a sickle shape. So this is where we're going to see those red blood cells that are shaped like sickles or like crescent moons. So here we can see a normal red blood cell, and here this one is sickled, looking kind of like a crescent moon. Now, some symptoms of sickle cell anemia is obviously going to be anemia, which causes fatigue, also swelling of the hands and feet, and also pain. And the pain is caused by the sickle cells actually blocking blood flow through really tiny blood vessels. Now, treatment mainly involves treating the symptoms of the disease, things like pain. We can also treat it by blood transfusions as well, though blood transfusions aren't really a permanent solution. Because of this, younger patients like children and teenagers who have sickle cell anemia can also get a stem cell transplant, and this actually cures the disease. So now we'll talk about hemophilia. So this is when we're missing coagulation factors in our bloodstream, so we don't get blood clots normally. So the level of clotting factors determines the extent and the severity of hemophilia. So if the clotting factor level is only slightly reduced, a person may only bleed a lot after surgery or after trauma. But if there's a large deficiency in clotting factors, a person may experience just spontaneous bleeding or spontaneous bruising, which is bleeding below the skin. Some of the symptoms of hemophilia include unexplained and excessive bleeding from cuts or injuries. We're going to see many large, deep bruises, or also pain or swelling in the joints, or even blood in the urine or stool. Now, hemophilia, just like sickle cell disease, is also an inherited disorder, and this is where, like I said, there's a deficiency in the clotting factors. Now, without the correct clotting factors present, the person's blood isn't going to clot, and they do experience a lot of bleeding. Now, the biggest risk factor for hemophilia is just having a family history of the disorder. The main treatment for hemophilia is to replace the clotting factors that are missing so that the blood can clot normally. Now, the interesting thing is that even during an excessive bleeding episode, the clotting factor replacement can be given to combat the bleeding at the same time. So that's pretty cool fact. And that's going to be the end of chapter 19.